Okay. The thyroid artery is the first anterior branch of external laryngeal carotid artery. It runs downwards and forward in intimate relation to the external laryngeal nerve. After giving branches to the adjacent structure, the artery passes the pretracheal fascia to reach the apex of the lobe, where the nerve deviates mainly at the upper pole. The artery divides into anterior and posterior branches. The anterior branch runs around along the anterior border of the lobe and continues along the apex of the upper continues along the upper border of the isthmus and anastomose with its fellow opposite side. Posterior branch will descend along the posterior branch descends on the posterior border of the lobe and posterior branch descends on the posterior border of the lobe and anastomose with the posterior branch descends on the posterior border of the lobe and anastomose with the ascending branch of the posterior thyroid with the ascending branch of the inferior thyroid artery. And now we are going to study about inferior thyroid artery. Inferior thyroid artery is a branch of thyrocervical trunk which arises from the subclavian artery. Inferior thyroid artery was the branch of thyrocervical. Inferior thyroid artery is a branch of thyrocervical trunk. Superior thyroid artery was the branch of external carotid artery. External carotid artery and inferior thyroid artery is a branch of thyrocervical trunk which arises from the subclavian artery. It runs downwards. It runs first upward, then medially, and finally downwards to reach the base of the gland. It runs first upward, then medially, and finally downwards to reach the apex of the gland. It runs downwards and forwards in intimate relation to the external laryngeal nerve. Mm, Now the inferior thyroid artery will run downwards and forwards and run downwards and medially and then forward and then up and upward, then medially and then downward to reach the base of the gland. During its course, it passes behind the carotid sheath and the middle cervical sympathetic ganglion in front of the vertebral vessels. In front of the vertebral vessels. During its course, it passes behind the carotid sheath and the middle cervical sympathetic ganglion in front of the vertebral vessels and gives off branches to the adjacent structures. During its course, it passes behind the carotid sheath and the middle cervical sympathetic ganglion and in front of the vertebral vessels and gives off branches to the adjacent structures. During its course, it passes behind the carotid sheath and the middle cervical sympathetic ganglion and in front of the vertebral vessel and gives off branches to the adjacent structures. During its course, it passes behind the carotid sheath and the middle of the cervical sympathetic ganglion and in front of the vertebral vessel and gives off branches to the adjacent structures. The inferior thyroid artery is a branch of thyrocervical trunk which arises from the subclavian artery. It runs upward, then medially, and finally downward to reach the base of the gland. During its course, it passes behind the carotid sheath, and It passes behind the carotid sheath. So, the inferior thyroid artery is a inferior thyroid artery. First point is that inferior thyroid artery is a branch of thyrocervical trunk which arises from the subclavian artery. It runs how it runs it runs upward and it runs upward, then medially and finally downwards, and then it passes where it passes behind the carotid sheath to carotid sheath. It passes behind the carotid sheath. It passes behind the carotid sheath It passes behind the carotid sheath and middle cervical sympathetic ganglion. During its course, it passes behind the carotid sheath and passes behind the carotid sheath. It passes behind the middle cervical sympathetic ganglion and in front of the vertebral vessels and gives off branches to the adjacent structures. And in front of the vertebral vessels, it gives off branches to the adjacent structures in front of the vertebral vessels. It gives off branches to the vertebral and in front of the vertebral vessels in front of the vertebral vessels and gives off branches to the adjacent structures. And in front of the vertebral vessel gives off branches to the adjacent structures. So we are studying about inferior thyroid artery. Its first point is that inferior thyroid artery. What is the inferior thyroid artery branch of? It is the branch of pretracheal, thyrocervical trunk. Thyrocervical trunk. It runs, and how it runs? It runs downward. It runs upwards and then downward, medially and then downwards. Mm, Medially and then downwards. It passes behind the carotid. It passes behind the carotid sheath and in front of the vertebral vessels. Mm, it passes behind the carotid sheath. It passes behind the carotid sheath and middle sympathetic ganglion in front of the vertebral vessels and gives off branches to the adjacent structures. It passes behind the carotid sheath. It passes behind the carotid sheath and the middle cervical middle cer- It passes behind the carotid sheath and middle cervical sympathetic ganglion and in front of the vertebral vessels. It passes behind the carotid sheath and in middle and the middle cervical sympathetic ganglion and in the front of the vertebral vessels and gives off branches to the adjacent structures. It passes behind the carotid sheath and middle cervical sympathetic ganglion, then in front of the vertebral vessels and gives off branches to the adjacent structures. And then gives off branches to the adjacent structures. The inferior thyroid artery is a branch of thyrocervical. The inferior thyroid artery is a branch of thyrocervical trunk, and it runs downwards and it runs upwards, then down medially and finally downwards to reach the base of the gland. During its course, it passes behind the carotid sheath and the middle. It passes behind the carotid sheath and middle cervical sympathetic ganglion in front of the vertebral vessels and gives off branches to the adjacent structures. In front of the vertebral vessels and gives off branches to the adjacent gives off branches to the adjacent structures. Bismillahirrahmanirrahim. During its course, it passes behind the carotid sheath and the middle cervical sympathetic ganglion in front of the vertebral vessel and gives off branches to the adjacent structures. It runs first upward, then medially, and finally downwards to reach the base of the gland. During its course, it passes behind the carotid sheath and middle cervical sympathetic ganglion, and in front of the vertebral vessel, then gives off branches to the adjacent structures. During its course, it passes behind the carotid sheath and the middle cervical sympathetic ganglion, and in front of the vertebral vessels, and gives off branches to the adjacent structures. Mm, It runs upwards and then medially and finally downwards to reach the base of the gland. During its course, it passes behind the carotid sheath and middle cervical sympathetic ganglion, and in front of the vertebral vessel, and middle cervical. It passes behind the carotid sheath and middle cervical sympathetic ganglion in front of the vertebral vessel and gives branches to the adjacent structures. So before giving branches to the adjacent structures, it will pass behind the carotid sheath, middle cervical trunk, and in front of the vertebral vessels and gives off branches to the adjacent structures. It runs first upward, then medially, and finally downward to reach the base of the gland. During its course, it passes behind the carotid sheath and the middle cervical sympathetic ganglion in front of the vertebral vessels and then gives off branches to the adjacent structures. Mm. It runs upward, then medially, and finally downward to reach the base of the gland. During the course, it passes behind the carotid sheath and middle cervical sympathetic ganglion and in front of the vertebral vessels and gives off branches to the adjacent structures. Gives off branches during its course. It passes behind the carotid sheath and in front of the cervical, in front of the middle cervical sympathetic ganglion and in middle cervical sympathetic ganglion in front of the vertebral vessels. Vertebral vessel, carotid sheath, sympathetic ganglion, and vertebral vessel. Carotid sheath, vertebral vessel, sympathetic ganglion, and vertebral vessels. Carotid sheath, 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 sympathetic ganglion, and then carotid sheath, sympathetic ganglion, and vertebral vessels. Carotid sheath, sympathetic ganglion, and vertebral vessels. Carotid sheath, sympathetic ganglion, and vertebral vessels. Use of branches to the sensor structures of Bismillahirrahmanirrahim. It runs upwards, then medially, and finally downward to reach the base of the gland. During its course, it passes behind the carotid sheath and it runs upward, then medially, and finally downward to reach the base of the gland. During its course, it passes behind the carotid sheath and middle cervical sympathetic ganglion in front of the vertebral vessel and gives off branches to the adjacent structures. It passes behind the carotid sheath and and middle cervical sympathetic ganglions and in front of the vertebral vessel and gives off branches to the adjacent structures. So we are going to study